So you are the first one to officially have PhD in nursing as far as Goa is concerned. Tell us about your subject. First tell us about you, where are you from, where are you teaching, and about your subject.
Okay, I'm from Kuttori, and I've been associated with the Institute of Nursing Education for 25 years and working there as an associate professor, and also taking up the role of Goa Nursing Council as a registrar. I register all the registered nurses and registered midwives.
You are the first one to have a PhD in nursing.
Yes, I claim that first because it's been a long journey, and it's quite satisfying to say that I am first, because there are many PhD in nurses who have done in other subject but not in nursing. So I claim to be the first in the subject relevant subject of nursing. And to get this, of course, it's been a challenging journey and a long journey, and that I have completed. My highest degree in the profession is the satisfying feeling that I get, that's a proud feeling in the professional field that I have done.
Tell us about your subject. Where did you do your PhD and how much time it took for you?
Yeah, PhD, it's actually very difficult for us to get in our nursing. We have Indian Nursing Council Consortium where we have to wait in queue to get a guide. So till then I tried a lot to get into different universities also. In fact, I went in my Manipal, where I've done my PG in 1999, and I asked to get in for a PhD where it was full time, 3 years time, which was not possible for me to get into it since I've been married, having a family, so was not ready to sacrifice that aspect, and looking out for part-time PhD, wherein finding I got in Enopoya, which was a very good university, gave me good support system, and I completed it over there this 2025.
What was your subject and what was the sample size, and the geographically where was this sample size picked up?
Yeah, to get in this topic, we have to have a relevant person, expert in that field as a co-guide here. That also was a difficult situation for me to search for a co-guide, and my co-guide, Dr. Atabole, I had taken because he was the then president of Konkan area Diabetic Association. So to diabetic, as it is a common field, I could get many number of patients also. So to find the sample size, we have to go through a statistician and get the sample size. So doctor also helped me in getting the patients. So we had actually through sample size, I had two groups, like it was an intervention and a control group. So in actually 150 was the sample size for each group, intervention and the control. And I had to do this study to prove that the diabetic education helps the patients to reduce their diabetic HbA1c as a, the robust measure to reduce the diabetic, the standard. The level has to be as good for the patient to have a good quality of life.
So Goa's, as per recent survey, Goa's 26% population is diabetic and 20% population is pre-diabetic, means they can enter this 26% of lot any given time. Since your area of interest is diabetes, can you just tell me how do we prevent these guys to get into diabetes, and also whether diabetic can be reversed?
The topic was interesting to me as I ventured into this topic in 2016. We didn't have a proper data on this, and eventually now everything is in place. And what you said is right, 20% pre-diabetes, that's the target population I had captured. And if you see diabetic can be prevented if you take it at the right time, that's pre-diabetes, and that's what my study is. If you take care of yourself, that self-education is very important, self-management is very important, that you reach out to a target level where you can reduce your diabetes with lot of control measures. I had taken 6 domains, like we say in exercise, diet, then problem solving, risk managements. These are many of the fields which I had taken into my study to prevent diabetes occurring into the adults.
Okay.
My sample size was on adults.
Okay, so your sample size was adults.
Yes.
What was the age group that you had checked on?
Yeah, I had taken from 20 to 70, because this is the age group which 20 I had to take, because we see now recent young children are also getting diabetes because of the unhealthy eating habits and behaviors. We do experience in the hospital young patients coming with diabetes and pre-diabetes. So my target area was to capture the whole of this population.
Also now with new things coming in, there is also a diagnosis much in advance, so that
Yes.
People are coming to know that I am on the borderline of being
yes,
diabetes.
Yes.
Is it also helping to reduce this percentage?
Yes. If you are conscious, yes, you can reduce it, and it may not be it is not reversible or irreversible. I wouldn't say, I wouldn't touch that area. Once you get, or you know, you're conscious, you can control it by your own self management, is the confidence that I give.
So for anyone who wants to do PhD in nursing, what are the subjects that they have to start with, and what is the first thing that they need to do so that they start, the first step towards PhD in nursing?
Yeah. Now on this aspect, as I said, guide is the priority. So you should, the guide also has a criteria. She has to have publications on her account. So some of it depends upon the university to university. The criterias are different. So we have to see that you get the title and the guide of the same category. Then plus, after venturing into the PhD registering, there is something called as coursework, which I had to go in Mangalore for 3 months. I had to stay there, and I had to answer an exam on that. Once that is done, then only you can register into your proper PhD title. And the subjects for this PhD nursing coursework is nursing theory. We do study a lot in grain and in depth about the nursing theories. And the second subject about research methodology and statistics, which is relevant to our nursing. And third subject is the subjects, the title speciality what you have taken. Like my speciality was medical surgical. So out of that, the whole depth about diabetes I had to learn before taking up the research work.
How many years it usually takes to complete your PhD?
Yeah, usually as per UGC guideline, 6 years for part-time, 3 years for full-time. And there was a circular for women, 8 years can be extended. So I took that opportunity of 8 years, and I had a problem, as I say, like a health issue. So 2 years went in my health problem, and 2 years of COVID obstructed me to further data collection, because my study was purely on the patient. So during that time I couldn't do the main study, so it delayed in taking the sample size, and data collection delayed my progress.
How did you feel when you are accepting that certificate of being PhD doctor, and you know that in front of your name Flosy there will be Dr. Flosy henceforth? Can you just describe that moment when you went on a stage and then
pick up? The thought came to me is, I have attained the highest degree in my profession. So as a profession, I am proud to be a nurse. More than to put up the doctor in front of me, I would say I am proud to be a nurse.
That was a thought.
Also, complete highest degree means completed in my profession, which I was passionate from 8th standard to be a nurse, and to take up step by step. Of course, after I completed my post graduation, I came with the thought, that's enough, I have done my final education, I don't want to venture into more. But when I came in Goa and saw the education system was so much low in the sense that there was nothing seedling in our state, and to bring up that passion was great in me. I wanted to have, because we have we had diploma in nursing, that is called as general nursing and midwifery, which was 3 years, as equal as graduate, but we would be awarded as diploma. So I could have completed my graduation by then with the 3 years. But as I like to be in the nursing, and I got opportunities to work as a staff nurse, which I refused because I wanted to do my higher education, higher, then next. And at the stage, as you said, like, it was a satisfying feeling ki this is the last degree what I have obtained in my profession. My professional values was really high in that way.
You are also registered for Goa Nursing Council. So tell us about that also. You will also include that first, if someone wants to be registered as nurse, what they should do. Secondly, what is Goa Nursing Council doing?
Okay.
Where are you based and about your activities?
Yes. Regarding registration, we have nurses in Goa who anybody can be called as a nurse, but registered nurse is with the qualification. So we have a qualification as BSc nursing, that's called as a basic, or one can do diploma in nursing. Both are valid and registered in the council. So with that you get a title of RN, RM, that is called as registered nurse, registered midwife. And then we have in our regulation, that is we have an act, that is what we are functioning in Goa Nursing Council. As per the act, every higher education or higher qualification can be registered if it is recognized by Indian Nursing Council. Indian Nursing Council is the apex body, and national council which we have in our country at Delhi, and we have different, at every state we have each state council, like almost 29 states we have council, and we have registrars of all over the state. We do go at the center for meetings and decide many of those things. So lately decision came from the Indian Nursing Council that the recognized universities, PhDs only can be registered in the council. So I take the privilege to register first in our Goa as a state nursing council higher qualification.
Okay, last question. Your PhD has helped you, in your life, but how will your PhD or your research will help in this diabetes management as far as Goa is concerned?
Yeah, I can give lot of this advices. As a nurse, it is my duty or responsibility, and being passionate in nursing, I can very well monitor, control with the help of advices. I can guide you to reduce your diabetic getting into progressive, and complications are very terrible about diabetes, which we see in the hospitals, and it's very sad to see the patient coming at the end, at the last minute, with amputated legs and kidney failure is a terrible scene which we observe in the hospital. So if I can do something for the patient, well, I would be very happy to help a person or give an advice to control the diabetes.
तुम्ही पळयतात GNH.